1,438 new cases is a very challenging day for Victoria.
This is more than a 50% increase on yesterday's daily numbers.
This is now an issue all across Melbourne. We now have cases in every LGA. We have cases in every suburb.
For long-suffering Victorians, it's a gut punch. Authorities pointing the finger firmly at rule-flouting footy fans.
There have been significant numbers of social gatherings on Friday and Saturday over a long weekend. Grand final parties.
Some poor choices have led to these case numbers today.
Mixed news in New South Wales, several regional lockdowns extended and 6 deaths recorded.
And can I pass on my condolences to their loved ones?
But with strong vaccine numbers and stable case numbers, schools set to resume a week early and some other freedoms to be fast-tracked as well.
There won't be major things, but there will be tweaks.
In Queensland, concern over 6 new cases.
Good news in that 4 of those 6 cases were linked to that cluster, but of course testing is absolutely crucial.
The growing Delta incursions seen NRL Grand Final attendance capped at 75%, with Stage 2 restrictions introduced in parts of the southeast, as well as Palm Island and the NRL's Plan B location of Townsville. That means mandatory masks, density limits in venues and caps on visitors to the home. The Premier willing to go harder if necessary.
As soon as Dr Young says we need to move into a lockdown, we will.
Back in Victoria,
today is a significant setback in how we've managed this outbreak. And if we see similar case numbers over the coming days, then we'll go from being just below the mean on the Burnett projection, so we were tracking favourably, we will jump to the worst quartile.
An already strained health system now in real danger of being overrun.
And if we're seeing continued spread of these kind of cases over the days ahead, it'll have very grave implications for our nurses, for our ambulance workers, for our hospitals and for people who need care.
But despite the risks, the Premier's determined to stay the course.
We are not turning back. We are finding a way to push through and get this place open.
Well, as we so often do on these difficult days, we turn now to epidemiologist Professor Tony Blakely for comfort, and he joins us now. Tony, shocking numbers out of Victoria today. If this isn't a one-off and cases continue to spiral, does this push back the reopening plan, do you think?
Yeah, possibly. But let's think about this a bit more. This is largely transmission amongst younger people disobeying the rules. At least that's my understanding of it. If that's the case, then if it's younger people, that may not drive the hospitalisation rate as high as would be a panic zone. At the moment, we're about 400 beds occupied. If you look at the Burnett Institute, which they did with the Victorian government, it was 2,500 beds occupied at any one point in time, which was the critical line. So we're well short of that. I'm not saying we can go a lot higher on numbers, but what I think the Victorian government might want to start doing each day, as well as giving us the numbers, is actually saying, and based on these numbers, we expect the hospitalisation rate in 2 weeks' time to be blah, because that's what we need to start focusing on.
Hard to read, though, because they're young now, but that's the start of a chain of transmission. You don't know where it's going to go.
Yeah, that's true to some extent, and that's a good point. And they can take it back to their grandmother and their parents and all that sort of stuff. But as far as where the hospital rate's going to be in 2 weeks' time, you can use the age profile of the cases occurring today and in the last few days to try and estimate it. And that's what we're really worried about now. We don't want to crash through our hospital capacity. That's the major concern now. So if these are large, I'm not sort of trying to make an apology for it, but if these are largely young cases, it's not as severe as if they are including older people as well. But you're right, Waleed, that it can now spread to the older people as well.
Yeah, and I understand the point you're making there. We have another grand final coming up this weekend and another city, that is Sydney, that's locked down, that will be hugely interested in it. If you're the New South Wales government, what are you doing?
You're basically saying, look what happened in Victoria, don't do that. It's basically, please comply with the rules. Now, New South Wales is ahead of us on the vaccine coverage. That gives them a little bit more buffer. I don't think they're into cancelling the event. As far as Queensland, say, with the final coming up there on the Sunday, I would be very jittery if I was in Jeanette Young's shoes at this point in time, because they're in a different kettle of fish, if you like, because they actually don't have much COVID and they want to keep zero COVID for at least another couple of months till they got the vaccine coverage up. And I think that's a much trickier call to make. And that's where Jeanette Young needs to be looking at the data, seeing whether those cases are all nicely quarantined and she doesn't think that they're going to be at risk of spreading out through a major footy final.
Well, we've already seen them, Tony, I guess, reduce the capacity down to 75%. At what point do they need to move that grand final out of Brisbane?
Yeah, well, again, that's Jeanette Young's call. If I was the Chief Health Officer, and I had some more cases popping up, and I'm probably looking at them every couple of hours as they're coming in, and there were some mystery cases around the place, and now particularly in that Brisbane area where the fan base is coming from, I'd probably be hitting the lever, send it to Townsville. So it really does depend on the data that we as citizens don't see, that Jeanette and the other people inside Queensland government get to see at this point in time. But it must be a pretty tight call, I would expect.
So Dan Andrews has said that hundreds, maybe even thousands of the new cases were acquired through illegal activity in Melbourne. If that's the case, and we're really just watching rule breaking here, is there anything that the government can realistically do?
Well, there's always carrots and sticks, isn't there? On the stick side, more penalties, all that sort of stuff. But I think everybody realises now that we're Homo sapiens. We crave having social connectiveness, and we're really getting a bit over it. So this type of non-compliance, I don't want to be seen to be condoning it, but it's going to happen. So what can we do on the carrot side, which is just keep pushing out that vaccine into those communities? I think I heard today the Victorian cases, 97% were unvaccinated. So that means it's young, unvaccinated people going out, which is a deep irony, isn't it? Because it's supposed to be vaccinated people going out at the moment, but it's unvaccinated. So we need to get that vaccine into those communities to try and dampen down the chance of them catching it and spreading it on. But it's going to be a bit of a bumpy ride in the next couple of weeks to months.
And we've already seen the health system is already under immense stress, Tony. When does this surge of cases really start impacting hospitals right now?
Yeah, well, let's come backwards. From the Burnet Institute, they use 2,500, as I said before, which is the Victorian government sort of red line, if you like. And we're currently at 400 hospital beds. I reckon we'll be up at twice that in about 10 days, 2 weeks, because of the current surge. So that's still well within the capacity before you get to the red line. That said, it's not great. So, but, you know, we do have this capacity. We've been planning it for 18 months. So I think we're okay at this point. But we don't want to see those cases keep going up to 2,000 a day, 3,000 a day, because then you will crash on through. What can we do then? Tougher lockdown, more vaccination, all the normal stuff.
Meantime, our thoughts go out to all of those frontline workers. Thanks as always for your insight, Tony.
Pleasure. Hope it was useful.
From expert opinions to in-depth analysis and reporting, the Project YouTube brings you the biggest stories from Australia and around the globe. Hit the subscribe button now for news delivered straight to your feed.